Good afternoon, ladies and gentlemen, and my apologies firstly for the wait. As you know, that we had announced in the recent past the awarding of the PPP to Aspen Medical, which today we are signing the concession agreement between the Fijian government and Healthcare Fiji Private Limited. Healthcare Fiji Private Limited is the special purpose vehicle or the joint venture company, if you like, between Fiji National Provident Fund and Aspen Medical. Healthcare Fiji Limited, Private Limited, is 80% owned by the FNPF and 20% owned by Aspen Medical. But Aspen Medical, of course, is responsible for all the clinical outcomes at the Lautoka and Bar Hospital. We are joined this afternoon by Mr. Bruce Armstrong, who is the Group CEO of Aspen Medical Private Limited, Annette Outram, who is the General Manager of Health Solutions, Paul Dyer, who is the CEO of this Fijian hospital project, and of course we have the CEO of FNPF, Mr. Chochi Karoi, Mr. Viljame Vondonivalu, who is the Chief Investment Officer. I'd like to also acknowledge the presence of the IFC team. This IFC actually has played a very pivotal role in helping the Fijian government to further this public-private partnership. They helped us with the tender process, the selection, and the fantastic and invaluable expertise and information they provided us. So I'd like to, of course, acknowledge Deva Da Silva, who's the country rep of IFC, based here in Fiji. Recently he's moved to Fiji. We look forward to him staying here for a few number of years. Mr. Dawal Jam, who together with Ritesh Vij, who is also on my right, and Thomas Romo, who is joined by them, who is next to Ritesh, were the IFC investment officers. And they, over the past 12 months or so, have played a fantastic role in helping us and providing that level of expertise, and which obviously we could not have done without. I'd also like to acknowledge DFAT, the Australian Foreign Affairs and Trade Department, for the financial support they provided in respect of engaging IFC for the services that they have provided to ensure that we've been able to achieve this milestone achievement, which will be enormous benefit to ordinary Fijians in respect of providing them tertiary medical care facilities that we currently do not enjoy, such as cardiac surgeries being available 24/7, radiotherapy that is currently not available. We understand it's not available in any of the other Pacific Island countries. So there are enormous opportunities, not just for Fijians, but our fellow Pacific Islanders who could use Fiji as a medical center to access services that will be provided by Aspen Medical. Ladies and gentlemen, of course, I don't want to say too much. We've already said a number of given a lot of clarification on this, but I'd like to once again reiterate the point that we're very proud to have Aspen Medical work with us. We look forward to working with you in partnership. We look forward to working with FNPF because it's part of the concession agreement that we are signing today. The special purpose vehicle or the JV company will actually put up another structure that will have state-of-the-art operating theatre facilities and various other amenities that we currently do not have access to, and that will give access to our ordinary citizens the level of medical services that they have not enjoyed in Fiji hitherto. So thank you once again for everybody, and we look forward to this getting on the ground. We understand Aspen should be much up and running within 6 months' time, but we're already engaged with the local staff, and as we've said previously, this does not in any way mean any job losses. It means the engagement of the staff that are there. They have the option to work for Healthcare Fiji Limited, or alternatively they can join other public health facilities outside of Lautoka and Bar. So those opportunities exist for them. As we've also said, that the current services for which Fijian citizens do not pay any fees for, or whatever fees they pay at the Lautoka and Bar hospitals, they'll continue to apply. Does not in any way change that particular permutation nor any extra cost for them for the services that they currently enjoy.
Minister, Permanent Secretary for the Economy. Aspen Medical is proud to be an Australian company making a difference right across the Pacific by providing diversified healthcare services. But we are particularly honoured in this case to have been given the trust of the Government of Fiji to partner with FNPF, our partner, for the provision of health services under a public-private partnership arrangement. We look forward to bringing our considerable healthcare experience to support the Government of Fiji's strategic objectives to modernise and develop the Fijian health system, particularly in the areas of secondary and primary healthcare. National health capability development and capacity building will be at the foundation of this partnership between ourselves and the Government of Fiji. Can I also echo the Minister in saying I want to pass on my thanks first of all to our partners, the Fiji National Provident Fund, for the goodwill that they have shown in working with us so far and making us feel welcome in Fiji. Then could I also thank IFC also, who for the platform that they provided to make this project possible. Could I thank your own staff, Minister, for the way that they have approached it in their engagement with us. And finally, can I thank my own staff from Aspen Medical, who have worked considerably hard on this project that we feel passionate, excited, and we are looking forward to commencing in partnership with you.
Wonderful. Great. Great. Thank you. Thank you. Look forward to working with you. I'd also like to thank many of the people who've been working behind the scenes. In particular, the staff from the Solicitor General's office, in particular the Deputy Solicitor General, who's here with us, Ms. Tracy Wong, and the Permanent Secretary for Economy, Shiri from Ministry of Economy, Sonal, and many other people, and I'm sure there are some FNPF staff too who've been working behind the scenes also who are here with us. Please turn around and acknowledge them, they're all here. But I'd like to thank everybody. It's been a fantastic team effort because from what I've been told, this particular concession and the awarding of tender and the scrutiny, etc., has been done in perhaps a very record time. But it's been done extremely well. And we had the director of IFC here a couple of days ago, and we met up with him, and he was quite complimentary of the wonderful work that's been done, of course, by his team, but the Aspen team, and of course the team from the Ministry of Economy in particular, and the Solicitor General's office in particular also. So I'd like to thank everybody. I think we should all put our hands together.
Oh yes, absolutely. Well look, let me say first and foremost, we recognise the great effort of the clinical staff in both the Lautoka and the Bar hospitals, and the effort that they have been putting in servicing and providing clinical services. But look, we start by going into an observation period. We'll be forming one team with the staff who are there at the moment to make our plans on how this will be delivered in the best and most efficient way and the most quick way. And we expect that will go for maybe about 3 months after we get started on that. And then once we have a plan, then we will be well into, and we'll commence the project, and we will be carrying out all of those improvements and development that we see that we identify during that observation period.
Do you have any timeline in terms of your observation period?
Well, I think that should go for about 3 months, but it might be extended a little bit longer than that. We are keen to start being responsible for delivering the services as soon as we can, and then there is a 3-year construction period after that.